Every year, thousands of people over 60 have strokes and don't realize it until it's too late. Not massive, obvious strokes, silent strokes, mini strokes, TIAs, transient ischemic attacks that come and go within minutes but leave permanent damage. One of the earliest warning signs appears not in your chest or your limbs, but in your face. Specifically, in your ability to raise your eyebrows symmetrically. Research from the American Stroke Association shows that facial weakness, even subtle asymmetry that most people dismiss as just aging, is one of the strongest predictors of stroke risk and often appears weeks or months before a major event. The eyebrow raise test is a simple, 5-second assessment you can do at home that reveals facial nerve function and stroke risk better than waiting for obvious symptoms. If one eyebrow won't lift as high as the other, if one side of your face feels weaker, or if the movement looks uneven, your body is sending you a warning. Today, I'll show you exactly how to interpret this test and what to do if you fail it. First, drop your name and where you're watching from below. By the end of this video, you'll understand exactly what the eyebrow raise test reveals about your facial nerve health, stroke risk, and neurological function, and you'll learn the specific warning signs that require immediate medical attention versus those that need monitoring. This simple test could save your life. This video discusses neurological warning signs, not medical diagnosis. If you experience sudden facial weakness, difficulty speaking, arm weakness, or confusion, call emergency services immediately. These are signs of stroke requiring urgent treatment. This video is for awareness and early detection, not emergency response. Let me explain what the eyebrow raise test actually measures and why it's so predictive of serious neurological problems. What the test reveals: facial nerve function and stroke indicators. Your facial nerve, cranial nerve 7, controls all the muscles of facial expression on both sides of your face. It's a paired nerve, with one branch controlling the left side and one controlling the right side. When both sides work properly, your face moves symmetrically. When one side is compromised, asymmetry appears. The eyebrow raise is particularly sensitive for detecting dysfunction because lifting your eyebrows requires the frontal branch of the facial nerve to activate the frontalis muscle. This muscle is one of the first to show weakness when the nerve is damaged or compressed. There are two types of facial nerve damage, and the eyebrow test helps distinguish between them. Upper motor neuron damage, which comes from the brain, typically from stroke. In this case, you can still raise your eyebrows somewhat because the upper face receives nerve input from both sides of the brain, providing some redundancy. However, asymmetry will still be visible. Lower motor neuron damage, which comes from the facial nerve itself, as in Bell's palsy or direct nerve injury. In this case, the entire side of the face is affected, including complete inability to raise the eyebrow on the affected side. Both conditions are serious, but they have different causes, treatments, and urgency levels. How to perform the eyebrow raise test correctly. Stand or sit in front of a mirror in good lighting. Relax your face completely. Now, raise both eyebrows as high as you can, as if you're expressing surprise. Hold for 3 to 5 seconds. Observe carefully in the mirror. What to look for. Do both eyebrows lift to the same height? Does one eyebrow lift higher or faster than the other? Does one side feel weaker or require more effort? Do the wrinkles on your forehead appear symmetric, or are they deeper or more pronounced on one side? Now try raising each eyebrow individually. Can you lift the right eyebrow alone? Can you lift the left eyebrow alone? Does one side feel significantly harder to control? Finally, try other facial movements to assess overall facial nerve function. Smile broadly, showing teeth. Are both sides of your mouth lifting equally? Close your eyes tightly. Do both eyes close completely and with equal strength? Puff out your cheeks with air. Does air leak from one side? These combined movements give a complete picture of facial nerve health. Interpreting your results. What asymmetry means. Result 1. Perfect symmetry. Both eyebrows lift equally, wrinkles are even, no weakness detected. This is normal. Your facial nerve function is intact. Continue monitoring monthly, especially if you have stroke risk factors like high blood pressure, diabetes, or atrial fibrillation. Result 2. Mild asymmetry with full movement. One eyebrow lifts slightly less than the other, but both achieve significant elevation. Wrinkles are slightly uneven, but present on both sides. This could indicate early nerve compression, previous minor stroke, or benign age-related changes. Monitor closely. Repeat the test daily. If asymmetry worsens, see your doctor within 1 week. Result 3. Moderate asymmetry with limited movement. One eyebrow barely lifts or lifts significantly less than the other. One side of your face feels noticeably weaker. This is concerning and requires medical evaluation within 24 to 48 hours. This could indicate developing Bell's palsy, thanks in advance, or other neurological issues. Result 4. Severe asymmetry or complete paralysis. One eyebrow won't lift at all. One entire side of your face is weak or paralyzed. You cannot close one eye completely. One side of your mouth droops. This is a medical emergency. Call 911 immediately. This indicates either acute stroke or severe Bell's palsy, both requiring urgent treatment. Why this test predicts stroke risk. Stroke occurs when blood flow to part of the brain is blocked or when a blood vessel ruptures. When the area of the brain controlling facial movement is affected, facial weakness appears. But here's the critical part. Facial weakness often appears before other stroke symptoms or during mini-strokes that resolve quickly but indicate high risk for major stroke. A study from the New England Journal of Medicine found that patients who experienced transient facial weakness, even if it resolved within hours, had a 25% chance of major stroke within 90 days if left untreated. The eyebrow test catches this warning sign early. Additionally, chronic subtle asymmetry, not sudden, can indicate silent strokes. Small strokes that occur without obvious symptoms, but accumulate over time, causing cognitive decline, balance problems, and increased risk for major events. Regular eyebrow testing allows you to establish your baseline and detect any changes immediately. Bell's palsy versus stroke. How to tell the difference. Both conditions cause facial weakness, but they're very different and require different responses. Bell's palsy is sudden paralysis of the facial nerve, usually caused by viral infection or inflammation. It affects the entire side of the face, including the forehead. You cannot raise the eyebrow at all on the affected side. It develops rapidly, often overnight. It's not life-threatening, but requires prompt medical treatment with steroids and antivirals to maximize recovery. Stroke affects the brain, not the facial nerve directly. Facial weakness is typically accompanied by other symptoms: arm or leg weakness on the same side, slurred speech, confusion, difficulty walking, severe headache, or vision problems. The forehead may be partially spared, meaning you can still wrinkle your forehead somewhat on the affected side. The FAST test is the standard stroke assessment. Face. Ask the person to smile. Does one side droop? Arms. Ask them to raise both arms. Does one drift downward? Speech. Ask them to repeat a simple sentence. Is speech slurred or strange? Time. If you see any of these signs, call 911 immediately. If you fail the eyebrow test and have any additional symptoms from the FAST criteria, do not wait. Call emergency services. If you fail the eyebrow test but have no other symptoms, contact your doctor the same day for urgent evaluation. Even isolated facial weakness requires professional assessment. Conditions beyond stroke and Bell's palsy that affect eyebrow movement. Facial nerve tumors. Rare but possible. Particularly acoustic neuromas that compress the facial nerve as it exits the brainstem. Gradual, progressive asymmetry over weeks or months. Requires imaging and specialist evaluation. Lyme disease. Can cause facial nerve inflammation and paralysis, similar to Bell's palsy. More common in certain geographic regions. Treated with antibiotics. Ramsay-Hunt syndrome. Reactivation of shingles virus affecting the facial nerve. Causes facial paralysis, plus ear pain and rash. Requires antiviral treatment. Facial trauma or surgery. Previous injury or surgical procedures near the facial nerve can cause long-term weakness or asymmetry. Neurodegenerative diseases. Conditions like ALS or myasthenia gravis can affect facial muscles, though typically with other widespread symptoms. Any persistent asymmetry warrants medical evaluation to rule out these conditions. Exercises to maintain facial nerve health and muscle tone. While you cannot prevent all facial nerve problems, you can maintain muscle strength and nerve stimulation through regular facial exercises. Eyebrow raises. Practice raising eyebrows symmetrically, 10 repetitions, 3 times daily. This keeps the frontalis muscle active. Forehead scrunches. Furrow your brow. Hold for 5 seconds. Release. Repeat 10 times. Smile exercises. Smile broadly, showing teeth. Hold for 5 seconds. Release. Repeat 10 times. This trains the muscles around your mouth. Eye closure exercises. Close eyes tightly. Hold for 5 seconds. Open wide. Repeat 10 times. This strengthens the orbicularis oculi muscles. Cheek puffs. Puff out your cheeks with air. Hold for 5 seconds. Release. Repeat 10 times. These exercises don't prevent nerve damage, but they maintain muscle tone, improve circulation to facial tissues, and help you notice changes more quickly because you're actively engaging these muscles daily. How often should you test yourself? If you have no stroke risk factors and no facial asymmetry, test yourself once a month as part of general health monitoring. If you have stroke risk factors, high blood pressure, diabetes, atrial fibrillation, previous thanks in advance, high cholesterol, or smoking history, test yourself weekly. If you've had previous Bell's palsy or facial nerve issues, test yourself daily, especially during times of stress or illness when recurrence risk increases. If you notice any change, any new asymmetry, test yourself daily and contact your doctor immediately. The goal is early detection. Facial nerve problems and strokes are far more treatable when caught early. What to do if you fail the test? Sudden onset, complete paralysis, or weakness with other symptoms? Call 911 immediately. Do not drive yourself. Do not wait. New asymmetry without other symptoms. Contact your doctor the same day for urgent evaluation. You likely need imaging, MRI or CT scan, and neurological assessment. Chronic mild asymmetry that's stable. Schedule a routine appointment with your doctor. Discuss stroke risk factors and prevention strategies. Consider referral to neurology for baseline evaluation. Never ignore facial weakness. It's not vanity. It's neurology. And in neurology, time is brain. Your face is telling you something every day. Most people never listen, but now you know how. The eyebrow raise test takes 5 seconds. It requires nothing but a mirror, and it could reveal a problem that, if caught early, changes everything. If you're going to start testing yourself weekly, leave a comment and commit to it. And if this video taught you something that could save your life or someone else's, share it. Because stroke warning signs aren't always obvious. Sometimes, they're as subtle as one eyebrow that won't quite lift. Because the strongest thing about you isn't your face. It's your willingness to pay attention to what your body is trying to tell you.